When I look around my campus, I see the faces of the women affected by this lack of contraceptive coverage. And especially in the last week, I have heard more and more of their stories. On a daily basis, I hear from yet another woman from Georgetown or from another school or who works for a religiously affiliated employer, and they tell me that they have suffered financially, emotionally, and medically because of this lack of coverage. And so I'm here today to share their voices, and I want to thank you for allowing them, not me, to be heard. Without insurance coverage, contraception, as you know, can cost a woman over $3,000 during law school. For a lot of students who, like me, are on public interest scholarships, that's practically an entire summer's salary. 40% of the female students at Georgetown Law reported to us that they struggled financially as a result of this policy. One told us of how embarrassed and just powerless she felt when she was standing at the pharmacy counter and learned for the first time that contraception was not covered on her insurance, and she had to turn and walk away because she couldn't afford that prescription. Women like her have no choice but to go without contraception. Just last week, a married female student told me that she had to stop using contraception because she and her husband just couldn't fit it into their budget anymore. Women employed in low-wage jobs without contraceptive coverage face this same choice. A friend of mine, for example, has polycystic ovarian syndrome, and she has to take prescription birth control to stop cysts from growing on her ovaries. Her prescription is technically covered by Georgetown's insurance because it's not intended to prevent pregnancy. Unfortunately, under many religious institutions' insurance plans, it wouldn't be. There would be no exception for other medical needs. And under Senator Blunt's amendment, Senator Rubio's bill, or Representative Fortenberry's bill, there's no requirement that such an exception be made for these medical needs. When this exception does exist, these exceptions don't accomplish their well-intended goals, because when you let university administrators or other employers, rather than women and their doctors, dictate whose medical needs are legitimate and whose are not, a woman's health takes a back seat to a bureaucracy focused on policing her body. For my friend, and 20% of the women in her situation, she never got the insurance company to cover her prescription, despite verification of her illness from her doctor. Her claim was denied repeatedly on the assumption that she really wanted birth control to prevent pregnancy. She's gay, so clearly, polycystic ovarian syndrome was a much more urgent concern than accidental pregnancy for her. After months of paying over $100 out of pocket, she just couldn't afford her medication anymore, and she had to stop taking it. Without her taking the birth control, a massive cyst the size of a tennis ball had grown on her ovary. She had to have surgery to remove her entire ovary as a result. On the morning I was originally scheduled to give this testimony, she was sitting in a doctor's office, trying to cope with the consequences of this medical catastrophe. Since last year's surgery, she's been experiencing night sweats and weight gain and other symptoms of early menopause as a result of the removal of her ovary. She's 32 years old. As she put it, if my body indeed does enter early menopause, no fertility specialist in the world will be able to help me have my own children. I will have no choice at giving my mother her desperately desired grandbabies. In the media lately, some conservative Catholic organizations have been asking, what did we expect when we enrolled at a Catholic school? We can only answer that we expected women to be treated equally, to not have our school create untenable burdens that impede our academic success. We expected that our schools would live up to the Jesuit creed of cura personalis, to care for the whole person by meeting all of our medical needs. We expected that when we told our universities of the problems this policy created for us as students, they would help us. We expected that when 94% of students opposed the policy, the university would respect our choices regarding insurance students pay for completely unsubsidized by the university. We did not expect that women would be told in the national media that we should have gone to school elsewhere. And even if that meant going to a less prestigious university, we refuse to pick between a quality education and our health. And we resent that in the 21st century, anyone thinks it's acceptable to ask us to make this choice simply because we are women.